Applications for ketosis, how it is used today. Now, throughout this entire course, we've focused on our body's ability to utilize fat as fuel for the mode of weight loss and fat loss. But the fact of the matter is that today scientists and researchers are finding ways to utilize ketosis as a means to treating certain disease states. Very interesting developments, very interesting stuff. Let's go through it together. So the first disease state that we're going to talk about, and we've talked about plenty throughout this entire course, is diabetes. Now, this is basically a dysfunction of your ability to uptake sugar due to insufficient insulin activity. So it would only make sense that why can't we just use ketosis to treat this disease? So let's go through a few things together first. The International Diabetes Federation has stated that 382 million adults are currently diabetic, and by 2035, that number will rise to almost 600 million. Now we're talking about a little over 15 years, that number is going to increase by 60%, more than 50%. That's insanity. This is an epidemic. Clearly we are doing something wrong. Clearly something needs to change. Type 1 and type 2, so let's go over it together once again. Type 1 in 5,000 people are going to be affected by this. You have to be born with it, but basically what happens here is that the beta cells of the pancreas are destroyed by the body's own immune system. The beta cells are going to be responsible for producing insulin. So if you don't have these cells in order to produce the hormone that is responsible for uptaking sugar, we've got a serious problem. And now we have type 2, less than 200 million people worldwide this affects. It's basically going to be diagnosed by insulin resistance. The signaling is damaged and insulin is less effective. So while type 1 you have to be born with and you cannot create any insulin, that hormone cannot be created by the human body, type 2 is going to be insulin resistance. Essentially, your insulin becomes less effective, signaling is damaged, and your ability to uptake sugar in the body will go down. Type 1 diabetes and ketosis. Now, the research is still in its infancy. Many cases of type 1 diabetes utilizing a ketogenic diet that is closely monitored by their doctors have proved to be effective. Now, when it comes to ketosis and type 1 diabetics, you have to understand that your body cannot create insulin. So even the littlest amounts of carbohydrates that enter the body can be a very big problem. It's very important that this person who is a type 1 diabetic, if they're deciding that they want to become ketogenic, you need to do it under the supervision of your doctor or of a health professional. Dr. Einfeld, his application showed a decreased dependency on insulin as well as improvements in GI issues, headaches, leg pain, throat, and yeast infections. So we're talking about from an inflammation standpoint. We're also talking about from a metabolic standpoint. It is possible, and it has been done plenty of times before, that type 1 diabetics can utilize a ketogenic diet. It needs to be monitored very, very closely. Type 2 diabetes. So I thought this quote was appropriate. It's from the Ketogenic Bible. Imagine you have a bike that has a tire with a small cut in it, causing the tire to leak air. Rather than patch the tire, you carry an air pump with you all the time, similar to pumping air into a leaky tire. Insulin injections provide a temporary fix to a much larger problem, which is insulin resistance. Again, that's from the Ketogenic Bible. So as this quote demonstrates, you can continue to live your life the way that you did before you were a type 2 diabetic. All you have to do is make sure that you are injecting insulin or getting an insulin pump. Now, as the quote says, this is basically just putting a Band-Aid over a much bigger problem. We are insulin resistant. Our pancreas is not creating insulin the way that the cells need. Signaling is damaged. Or what we can do is we can understand that fat can be used as the primary fuel source, and we can switch it over to fat rather than rely heavily on insulin. Supplementing ketone esters in mice improved insulin sensitivity by 73%. BHB, remember, is beta hydroxybutyrate. That is the ketone that is actively in the blood. infused into human subjects raised blood ketone levels to 3.5 millimole per liter, creating a 40% increase in insulin sensitivity. Now let's take a look. We've got a 73% increase in insulin sensitivity and 40% increase in insulin sensitivity. Now, the biggest takeaway from the 2 bullet points here is that you are not relying heavily on insulin. And so that time that you're not relying heavily on insulin will help to actually, over time, increase your insulin sensitivity. Really what this means is that your diabetes can almost be reversed, not to the point where it's completely cured, but we're talking about insulin sensitivity, your body's ability to understand that there is an insulin signal and that your insulin is now becoming more effective. This is a big deal. As levels of BHB increased, diabetic nephropathy, which is damaged capillaries in the kidneys, was reversed. Essentially, as ketones in the blood rise, your kidneys will start to heal. Big deal. So now let's talk about epilepsy, which is a neurological disorder characterized by recurrent spontaneous seizures. Over 20 million people worldwide have epilepsy. Earliest documented treatment for epilepsy was by Hippocrates, who prescribed fasting as a cure. It worked. Now, the reason why it worked is because there's a problem in the brain, as you probably might have thought, and that problem is going to be glucose metabolism. Now, it's insufficient. What we're finding in the brain is we're really finding insulin resistance of the brain, and that's essentially what's happening. Now, while your brain understands that there is fuel present, it's not getting the signal, and so it cannot use that glucose to do the normal functions that it does. One study showed that consuming 60% of total calories as medium chain triglycerides led to a 50% reduction in seizures. That is significant. Remember, medium chain triglycerides are going to easily be converted to ketones, but understand that the higher amount of medium chain triglycerides that you have in your diet, the greater the chance that you have gastrointestinal distress. So look out for that. Other treatments used are low glycemic index therapy and modified Atkins diet, more focused on carbohydrate load and timing than fat percentage. Studies have shown that the more strict the ketogenic diet, the lesser amount of seizures. So thinking of it this way, as fat and carbohydrates get further and further apart, the stricter the ketogenic diet. So for example, if we have 90% fat and 5% carbohydrates, that is a very strict ketogenic diet. If we have 60% fat and we have 15% carbohydrates, that's not very strict at all. Alzheimer's disease. The cause of it is a buildup of amyloid plaques that inhibit neuron function and clumps of protein known as neurofibrillary tangles. Also known as type 3 diabetes. The really amazing thing here is that if you're a type 2 diabetic, you actually have a 10 times greater chance of developing Alzheimer's. That's why they call it type 3 diabetes. Insulin resistance is present in the brain, so as we discussed with epilepsy, your body, your brain understands that glucose is its primary source of fuel, but the problem here is that it cannot utilize it very well because there's insulin resistance in the brain. It can't use it. So we need to find another fuel source that the brain can use. Push-pull. Pushing glucose into a brain that is resistant, or ketone concentrations in the blood increase the utilization of them in the brain. So if you're somebody who is still utilizing glucose in the brain and you have Alzheimer's, you're going to have to push lots of insulin in order for that glucose to be used. Or what you can do is you can rely on using ketones as your primary source of fuel. And the higher the concentration of ketones are in the blood, the more the brain is going to pull those ketones to the brain to use. So instead of forcing the issue by using glucose, we can actually make ketones used and present, and the brain is just going to pull them right in. It's going to suck it right up. Transportation and uptake of ketones in people with Alzheimer's disease are unaffected. So just because you have glucose metabolism issues in the brain doesn't mean that if you have lots of ketones in the blood and you're now becoming ketogenic, that it's going to be impaired for ketones. The brain is going to suck up those ketones right away. The higher the concentration, the more the ketones your brain is going to use. It's truly amazing stuff. So there was a research study. Subjects consumed a mixture of 40 milliliters of MCT oil and 200 milliliters of heavy cream. Subjects participated in a memory test, improving their scores significantly. So people who were consuming 40 milliliters and 200 milliliters of medium chain triglycerides, essentially, because that's what heavy cream really is, then you're going to see these people have an increase in memory scores. So as you can see here, that's exactly what happened. On the left here, you're going to see blood ketone concentration. That's essentially the amount of ketones that are going to be in the blood. The higher that it is, the better the scores of these people were going to be. And we're going to see a direct relationship with that. Parkinson's disease. 100,000 deaths per year, affecting more than 50 million people around the world. Some of the symptoms of Parkinson's disease are shaking, difficulty keeping posture, difficulty walking, rigid muscles, dementia, emotional issues, and depression. Mitochondria of the cell not functioning properly. So as we've talked about in past discussions, the mitochondria of the cell is arguably the most important part of the cell and has everything to do with metabolism. Now, what happens with the mitochondria, it takes the food that you actually eat and it converts it to energy that can actually be used by the body. Now, if there's a dysfunction in this mechanism in the cell, we're going to have some serious health complications. Individuals with Parkinson's have a drastic reduction in glucose metabolism in the brain. So you're starting to see a trend here with neurological disorders that glucose metabolism is very much impaired. And so what we need to do is we need to find another source of fuel. Just forcing glucose into the blood and just thinking that if I just put more glucose into the blood, it's going to be okay, is not really the way to go about it. We need to start using another source of fuel, and ketones seems to be the most efficient method to do so. Research has shown more than 60% of Parkinson's patients have impaired insulin signaling and cannot effectively use glucose for energy. So as we've discussed before, glucose and insulin resistance in the brain, and this is across the board. There's something that we need to do about this. We need to find another source of fuel. So now we're talking about cancer. The abnormal formation of cells followed by those cells multiplying. So where it all started for cancer treatment, we had extreme surgery, just very invasive and just removing the tumor altogether. X-ray, radium, and mustard gas is where it all started. Later, the understanding that the very treatment being practiced could also be responsible for gene mutations and damage. So what they started to realize is that even though it was killing cancer cells, we were also damaging healthy cells as well. Not only that, further mutating genes in healthy cells. So pretty much just pushing along the cancer process. Ways it can spread: sustained growth signals, non-functioning anti-growth signals, apoptosis, malfunction, unlimited amount of times the cell can divide, angiogenesis, metastasis, and mutations. Evidence suggests that there is a direct relationship between high blood glucose levels and tumor growth. The Ketogenic Bible, what they're saying is that tumors, cancer cells, in order for them to spread, in order for them to metastasize, they need to feed on something, just like any other living organism. And for cancer cells, glucose is going to be their primary source of fuel. Now let's go over a couple of things here. So the fuel pathways for cancer, there's something called angiogenesis. Increase in glucose metabolism fuels this vessel formation to nourish the tumor. So essentially what's happening with angiogenesis in a cancer cell is that it creates capillaries, vessels that are going to be outstretched from the cell so that way it can extend its reach, so that way it can get more nutrients and other things that it needs in order to survive. Excess lactate, a byproduct of glucose metabolism, the excess is then used to surround the cancer cell in order to feed neighboring cancer cells. So remember, glucose is going to be the primary source of fuel for cancer cells. Now, glucose is then going to be broken down and the byproduct is going to be lactate. The excess lactate will then be surrounding the cell and it will have the ability to feed neighboring cells. It's a very efficient process. There's not going to be much waste and it furthers the cause of cancer. Glucose versatility doesn't have to break down. It can use it for whatever it needs. So essentially, cancer can use glucose for whatever it needs to in order to further its cause. It doesn't necessarily have to break it down. Another really interesting study that was done on rats, we have a combined ketogenic diet with hyperbaric oxygen therapy, and that's essentially where we're going to introduce high levels of oxygen at high pressure. And that could be very damaging to the cells, but it can also be very damaging to cancer cells as well. So bottom line here is that with a ketogenic diet plus hyperbaric oxygen therapy, you're going to find that tumor size is going to decrease. Pretty incredible stuff. So what do we take away from this chapter? We understand that glucose metabolism or impaired glucose metabolism might be at the forefront of all of these non-communicable diseases. Now, if we can understand that glucose might be the very problem, whether it be the impaired metabolism or glucose being the primary source of fuel for cancer, if we can understand this and make that switch to a more efficient fuel source in ketones, then we're going to be much better for it. Non-communicable diseases are going to go down. We're going to be much healthier for it. We're going to feel better. This is overall just great strides forward. I want to thank all of those scientists and researchers out there. Keep doing the fantastic work that you're doing. Let's move on with our course. Really excited for you guys. See you guys in the next.